So greetings. In this and the next video, we discuss about methodology, which is a key aspect of the protocol in this set of videos of thesis protocol right now. So in the methodology, you first preferably would describe the setting of your study. You explain your setting or the context where your study is going to be, where it is located, what kind of facilities are there, what is the kind of footfall if the study is based upon patients, who pays for treatment in these settings, because that can also determine what kind of people come and what kind of outcomes you expect, and what kind of patients avail services, what kind of services are available. So these information are useful to tell about the context of the study, because the context can be different across different places, and that might have something to do with inferring of generalizability of the study. You may be aware of the setting because you look at the setting on a daily basis, but the reader of the protocol might not be aware. So to inform that reader, it is a good idea to tell the methodology setting beforehand, so that the reader is aware of where the setting is to be and what are the characteristics of the setting. Then you tell about the study design. What is the study design should be mentioned upfront. The examples of study design can be cross-sectional observational design, it can be a cohort study, it can be a qualitative study, it can be randomized controlled study, it can be mixed method study. But telling this upfront will be enabling the reader to know what is the design of the study, what elements to expect in the further details in the methodology. Then you tell about the participants and you tell about the inclusion and exclusion criteria. For participant-based studies, mentioning the inclusion and exclusion criteria enables objectivity in recruitment. You do not include everyone who comes along. You need to have certain exclusion and inclusion criteria. For example, if your study is on patients with depression, then you need to mention diagnostic criteria of depression that you are going to use as a part of inclusion exclusion criteria, so that people are aware that these are the set of inclusion criteria used. If there are too many criteria, then you get a too homogeneous sample, but you have too restrictive criteria, makes it difficult to get your sample enrolled. So you need to have a balance, and it is better to discuss your inclusion exclusion criteria with your guide or your peers, so that you are able to complete the work at the same time. Your study sample is a little homogeneous and representative of the population that you are going to study. Then consent. Now it is important to mention about written informed consent or a waiver if requested to the ethics committee. For example, if it is a retrospective design where you want a waiver to be taken, you can mention that waiver would be sought from the ethics committee. Do not start your work or the data collection prior to getting the ethics committee approval. You should get consent and informed consent from the adults and assent from the children or adolescents. In cases of children or adolescents, you get the consent from their parents or legally acceptable representatives. Now, legally acceptable representatives can give consent on behalf when a person is incapacitated or a person does not have competence, or in cases where someone else is looking after the patient, or in the case of minors. Now, trial registration is also an important aspect. If it is a clinical trial, then it should be registered prior to starting the work. Trial should be registered prospectively, that is, prior to the data collection commencement. And in India, you can go to the CTRI website and register your trials. It's not too difficult. And then they mention your trial in their registry so that others can track. The reason why trials are registered in trial registries are that people do not replicate the same things and waste resources because trials can be expensive. Now then you show the procedure, your methodology. A flowchart of how the study will be conducted or carried forth would be useful. For randomized control trials, there is a consort guideline that are available and which mentions different steps. So you can mention the different steps that will be there, what time points assessments will be, and that can be a kind of a flow chart. Now, in the procedure, you need to mention what data will be collected, by whom, when, and how. Now, data can be collected in various ways. For example, it can be a questionnaire. For example, depression can be assessed using Hamilton Depression Rating Scale. Now, outcomes can be in the form of lab reports as well. For example, toxicology reports. It can be in the form of scales. It can be form of examinations, and it can be other methods of assessment as well. But it is important to mention what data will be collected, by whom, and how, so that issues of reliability and validity can be considered and given a due regard in the protocol itself. Now, details of the instruments or scales and questionnaires should be there. It should be mentioned how many items are there, how many questions are there, whether it is self-rated or clinician rated, whether it is free to use or whether you have to expend some money to use it, whether it is copyrighted or not, and the language of administration of the scale should also be mentioned. If the scale is in a different language uh, from where you intend to use it, then you should mention about the translational procedures that you are going to use to validate that scale, or to at least use that scale in a formalized way. With this, thank you very much. And I hope you look at the second video dealing with methodology section of writing a protocol of a thesis. Thank you very much.